Hello, this is Dr. Hall. We are going to talk about exercise for older adults. And in here, we're going to follow and analyze some topics about physical and physiological change and also benefit of physical activity, exercise prescription, and some training tips, modification, and precaution that we need to follow with this population. But in this occasion, we're going to go over and go focus on physical and physiological change. And it's important to know how to provide well designed exercise with evidence based prescription and programs that we can apply in this population, because it's a segment of population that is, is the fastest growing, and eventually all of us we are going to become an older adult, and sometimes we are not going to feel with that self-esteem with because we are not going to be able to do or capable to do the things that we did in the past. But it's important to understand very well this segment of the population for the exercise prescription and the program that we can design for them. And we're going to analyze some change with aging. Typically, aging of the human body is marked by muscular, cardiovascular, neurological, and skeletal change then reduce physical function and also predict morbidity. And we have four in here, like the plaque built in the artery wells that predispose people to have the heart attacks and strokes. And number two is loss of muscle mass, particular type 2. We are going to analyze this later, the type 2 muscle fibers. Then this basically are going to reduce muscle strength and power. And the plaque built in the brain is a precursor to dementia, including Alzheimer's disease, and the loss of bone mineral disease then is going to produce osteopenia and osteoporosis. And we're going to analyze later, but there's more, because in here we can quantify some change, physiological and physical change with aging. We had 10 that are going to decrease with age. These are the following function, like the heart rate, the cardiac output, also the VO2 max reserve, the reaction time, muscle strength is going to decrease, flexibility and bone mass is going to decrease, also glucose tolerance, and recovery time and lung vital capacity. But we have other changes with aging that are going to increase, like for example blood pressure and residual lung volume and the body fat percentage. So there are many others, but we briefly present these three for increasing. And now let's talk about these four aspects: sarcopenia and dyspnea, osteopenia and osteoporosis, the amyloid beta plaque and the brain, and also atherosclerosis. First, we're going to focus in sarcopenia and dyspnea, and we have the definition in here of these two factors of the or condition. And sarcopenia is the loss of skeletal muscle mass, and dyspnea is the loss of physical performance. We have a little bit in here to quickly understand the change with aging. Maybe you can see yourself in the left side because you are young, but in the future we are going to lose this fiber to a muscle fibers, and, this is going to reduce the muscle strength and power for us. Remember, we had three type of fibers, and the type 2 are going to be more affected for doing this activity. We have more about it in here because muscle power is determined by how quickly strength is external or for speed movements. So as we age, muscle quantity and quality decrease, and change in muscle mass result in losses of strength, power, and endurance, and also in coordination, and also in mobility. That is very important. And we have some facts in here, like 40% loss between age of 20 and 70, and muscle fiber diameter is reduced. And the type 2 that we talk about later, type 2 muscle fibers, which are responsible of power contraction, degrade much more rapidly than type 1 fibers. So it's important, this factor about sarcopenia and dyspnea. And we have more facts about this condition. About this is that progressive resistance training can reverse this change. Even in a 90 or 80 year olds, power movements enhance type 2 muscle fibers, and this change happen with aging, mimic what happens to muscle when it is immobilized. Like for example, broken bone is cast, but well, we can progressively reduce that doing exercise, and we're going to talk about in the next topics of this older adult. Now we're going to we analyze this fact about sarcopenia, and now we're going to go for the next, that is osteopenia and osteoporosis condition and disorder. And osteoporosis, basically the definition, the abbreviation of osteoporosis is OP, is a skeletal disease characterized by low bone mineral density, that is abbreviated as BMD, and change in bone microarchitecture, then increased risk of fracture. And this, the OP or osteoporosis, is defined as the bone density, bone mineral density at a score of less than 2.5, means is 25% lower than the average in a young adult. And that's the definition. And we can see in the picture different stage of osteoporosis: normal bone, osteopenia, osteoporosis, and severe osteoporosis. More about this disease is that we have the osteopenia, that is the precursor to osteoporosis. Is low bone mass, but not as much as with osteoporosis, and is defined as having the bone mineral density, the T-score of the lumbar spine, total hip or femoral neck, between less than 1 and less than 2. And we have over there the T-score of normal bone, osteopenia, osteoporosis, or severe osteoporosis diagnosis. So more about this change with aging in skeletal muscle is that a good news is that osteoporosis and osteopenia are more coming with advancing age. But the good thing is that exercise can play a key role in improve bone and muscle strength, and also balance and reducing the risk of fall. And there is a tool. It's called FRAX, the Fracture Risk Assessment Tool. It's a quick way to estimate bone fracture risk. In the next 10 years have been used as a good tool that basically was developed to evaluate fracture risk of patient, and is based in individual patient model that integrate the risk associated with clinical risk factors as well as bone mineral density at the femoral neck. And we analyze sarcopenia and dynapenia, we analyze osteopenia and osteoporosis, and now we're going to go to amyloid beta plaque and the brain. Let's check the definition in here about this, the amyloid beta plaque and the brain. And basically it's accumulation, this plaque in the brain is a hallmark of cognitive impairment and Alzheimer's disease. And while we don't understand exactly how exercise helps, studies show a relationship between higher exercise level and lower risk for dementia. And basically we have this, then AB, the A beta is a type of protein that clumps together to form plaques between neurons, and in the Alzheimer brain disrupting cell function. And this amyloid beta plaque levels in cerebral spinal fluid CSF indicate a high risk for plaque development. So in here we have some factors, important factors, because we must let's get people moving to help them ward off Alzheimer, because remember the relationship is not clear, but the prevalence of people between higher level of exercise and this condition is lower with this risk of dementia. So we have five several factors about change with aging and this condition. Then we need to be focused on it. There's several mechanisms that may influence this relationship, particularly in people with higher genetic risk. Exercise increase HDL, the high density lipoprotein that is linked this cholesterol protein to the brain, and it's important to maintain healthy axons, remodeling synapses and repairing neurons. Other fact is that exercise increase production and activity activate the enzymes that clearly the amyloid beta plaque from the brain. Another fact about exercise is that makes red blood cells less likely to bind with amyloid beta plaque and transport into the brain. And the last factor is that exercise reduce inflammation in the brain, which may slow the creation of these proteins, the amyloid beta plaque. Now we go for other fact. We analyze sarcopenia and dynapenia, osteopenia and osteoporosis, amyloid beta plaque and the brain, and we are going to go for atherosclerosis condition. And in here we had the definition. Atherosclerosis is the build of the plaque in the arteries, We had different stage over there that we can analyze in the picture: healthy artery, fatty streak, fibrofatty plaque, and complicated plaque. But when we reach our 40s and 50s, building plaques can be large enough to significantly reduce blood flow, contributing to cardiovascular disease. So this is these are the four factors that we analyze in this about low density lipoprotein. The cholesterol have an important role in this condition, in this change with aging. So with that, we are going to conclude this factor, and the next part of the lectures are going to be involved in benefit of physical activity, exercise prescription, and training tips, modification, and precautions.